The first word that comes to my mind is pain.
Unneeded pain.
Suffering is a loaded word.
Suffering encompasses all of those sort of negative physical experiences.
But it isn't always medical. I think of it as an emotional state.
The Latin core of the word patient is I am suffering. That recognition that I am suffering provides us with an imperative to try and figure out those ways in which we as caregivers can impact that suffering and reduce it. When I became a patient at Yale New Haven Hospital, it allowed for a different perspective. Seeing things in this position is entirely different than when you see things in this position.
So I was on vacation, went down to the ocean, dove into a wave where it pushed me into a sandbar. In a split second, knew that something's wrong. I can't move my arms whatsoever, can't move my legs, can't get up.
When an accident like this happens, it's something you never dream of happening. It's a time of so much uncertainty.
As high as you were because you have a brand new daughter in your arms, you're just quickly that low because she's being taken away from you to the NICU and you have no idea what's going on.
Dr. Morris was watching a couple of spots. He knew that that I had cancer, and I had to be told.
At that moment, it is too easy to fill the silence, fill my own anxieties. You say less and listen more.
If we wanted to create a healing environment for our patients, we needed to shift our thinking to have a willingness to see it from their perspective.
I always think of my family member in the bed or myself in the bed, and that really puts a different twist on everything.
A few of the causes of stress for me initially in the hospital were just not knowing what was next.
What made it successful was that those people communicated. Everyone was up to speed. They clicked. It was like a teamwork.
We changed the culture so that it's not a place where we are employed, but it's a place where our patients are healed. And that shift in focus, that shift in culture has become an effort with everybody who enters the floor.
So if we work together as a team, we can cluster our care together so that we can have less disruption. It is a workflow change, but it was the right thing to do for our patients.
Having nurses on your team that really attach with you on a personal level makes all the difference. You know they're not just there doing their job, they're there because they want to see you get better.
In the end, what it really comes down to is compassion, the compassion that caregivers show to families. Amanda's doing well. Here she is making all this progress, making believers out of us all.
The secret of the care of a patient is in caring for a patient. I think if we hold those sentiments close to our hearts, we will actually see a revolution in how we provide care.